Senator Boozman, are you ready? We'll remove the Senator Murkowski in front of you, and maybe somebody could replace it with his.
I stole her seat.
Yeah.
I saw her in the hallway.
Good.
I'm like a fireman. I stay ready. Here. Thank you.
You don't want to do that. Come on.
We've lost control. Well, thank you all for, I'm sorry, thank you very much, Senator. Thank you all for being here. We really do appreciate your service to your country and in so many different ways. Army leadership has worked tirelessly to restore readiness in the Army. As you know, readiness is fragile, and if not adequately sustained, it can decline quickly. This year's budget supports an Army end strength of 12,000 less than the authorized end strength of 485,000 active duty soldiers. Last week, you reasserted your position that you believe it's important to have a larger Army, but that you would prefer quality over quantity. General McConville, how is the active duty Army absorbing this loss, and where is the Army assuming risk?
Well, Senator, first of all, what we're going through right now is a process, and what it does is it leaves us less capability. You know, as we reduce the end strength, it means that we're going to have soldiers do more deployments than we would like, and so what we're trying to do is mitigate those risks by taking a look at organizations where we don't quite need that end strength or where we can man at less amounts. But we see this as a pause, a modest reduction in end strength. And as the recruiting winds change, we see the ability to bring back that end strength. And at least from where I sit, we do need a bigger Army.
Very good. In fiscal year 2013, the Defense Suicide Prevention Office received a base budget of $2 million. 10 years later, the DoD is requesting nearly $28 million for this office. This is double last year's budget and a $26 million increase from a decade ago. But the rate of suicides has continued to increase. It was recently reported that 2021 was the Army's highest level of suicides since the September 11th attacks. Just last week in this committee, Secretary Austin said suicide prevention and resiliency were a top priority for the department. Madam Secretary, in light of these recent reports of suicide in the Army and given the large increase to Suicide Prevention Office, what does the Army's relationship with this office look like, and are you involved in the strategy formulation process to address the DoD suicide problem? I've had the opportunity to deal with this for a long time in the VA, and we have a similar problem. When I came in 2001 in the House and was on the Veterans Affairs Committee then, we had 22 suicides a day. Here we are, you know, a couple decades later and still suffering essentially the same problem. So we're doing a number of different things to try and, you know, fight it at that level. So talk a little bit about the problem and how you feel like we best can respond.
Sure, Senator. And it is a problem, and it's a problem that General McConville and I are very concerned about, as are all the other leaders in the department. You know, I think the last couple years, you know, we're still sort of looking at the data on this, but it's, in my mind, it's very clear that the pandemic has deepened this problem or contributed to this problem, because I think, you know, our soldiers, like a lot of Americans, have been more isolated. And a lot of, you know, I think when people feel more connected, whether it's to their buddies or to their families, you know, they feel more supported. And the pandemic has chipped away at that. So that's why I think, you know, for example, that's probably part of why 2021 was such a bad year for the Army when it comes to suicides. We are working very hard on this. You know, as I said, we are you know, in Alaska, for example, we're doing 100% wellness checks. Everyone who is assigned to Alaska goes to see a behavioral health provider. We have at least one division that's doing that as well. We have provided a lot of training and resources to our commanders to try to help them identify, you know, early warnings. And, you know, it's still relatively early in this year, but at the moment right now, our suicide numbers are significantly lower than they were last year. So I think that is perhaps an indication that what we're doing is having some positive effect. but we're not going to take our eye off the ball, and we're looking forward to the results of the Secretary's Independent Review Commission on Suicide.
Good. No, we appreciate that very much. And one thing that we're trying to do in the veteran space is put some really good metrics in place so that we understand what's working, what's not working. The other thing that might be a benefit that we found there is that the outside entities in the community, some of them do a very, very good job. And, you know, in an effort to, we've actually done a little grant program to involve them, but I think that's something worthwhile looking at also, is how you involve these groups in the communities that again, like I say, deal with this in a different way, everybody working together to help identify and really start making a difference in the numbers. So thank you all again. We do appreciate your service in so many different ways.